Good afternoon. It's Sarah with the Department of Medicaid. It's not quite 2 o'clock, so we'll give it just a few minutes before we get started.
Thank you, Erin.
It is 2 o'clock and our waiting room is cleared. I currently only have Donna and Courtney logged in. If I missed any other TAC members, please let me know.
Perhaps in the interest of everyone's time, we can go ahead and get started and table the approval of minutes. Erin, remind me, do we have to have 3 or 4 members to have a quorum?
4.
Okay. Okay. If we establish a quorum in a few minutes, then we can go back to the approval of minutes. Is everyone okay with that? Okay. Well, welcome to the first Child Health TAC of the year. I'm Donna Grigsby. I'm a pediatrician at UK and am the chair. And my colleague, Dr. Smith, would you like to introduce yourself and say hello?
Sure. I'm Courtney Smith. I am a psychologist at the University of Louisville, Norton Children's Behavioral Health, and I also am representing the Kentucky Psychological Association on this TAC. So that's a little bit about me.
Great, thank you. And Erin, would you like for those that are from the MCOs to identify themselves in the chat?
That's up to you.
Okay. A lot of times we will ask you guys just to give us your names and the organization if you don't have that on your screen. So if you all wouldn't mind sending that to the chat, I would appreciate it. I know we do have a presentation on absenteeism. But I'm going to start with the Medicaid services for incarcerated youth. We have that listed as on the January meeting. Is anyone prepared to discuss that?
Hi, this is Sherry Staley from Medicaid and the Behavioral Health Policy team. We actually just had a meeting with DJJ this morning to discuss the workflow and about some of those questions about Medicaid month purity and those types of things. So those services are going to be available for incarcerated youth, the covered services are EPSDT screenings, medical, dental, and vision, and behavioral health, TCM for 30 days pre-release and 30 days post-release. And the approved settings are the youth detention centers, state prisons, and local jails. These are for adjudicated juveniles under 21 or former foster care youth ages 18 to 26. So some of those former foster care youth could be in state prisons or local jails.
Okay. And could you repeat those list of services? I was jotting quickly and then lost.
Oh, sure.
Yeah, sorry about that.
It's EPSDT screenings for medical, dental, vision, and behavioral health.
Okay,
And then TCM 30 days pre-release and 30 days post-release.
thank you. All right, thank you very much. Any questions? Do you feel like anything will change that we need to follow up with this in April, or you feel like that you all are pretty much that's what's going to happen and that's not going to change?
Well, as always, once you implement something new, there might be some lessons learned along the way. So we're open to changes, knowing that, we had a tight deadline for these types of things. We don't anticipate, much changing. What we would change on our side might be regulatory or those types of things, enrollment process, et cetera. But as far as the structure, we don't anticipate that changing.
Okay. Would you like to give us a brief follow-up at our April meeting?
Sure, that'd be
Okay.
great.
I would appreciate that. That way
No
we can
problem.
see if there are lessons learned and things that,
Yeah, we may be even able to report on some preliminary data for those
Okay.
first couple of months. So absolutely.
perfect. Okay, thank you. Thank you very much. Any other questions, comments? That was a timely addition to, or that was a timely thing on the agenda, so I'm really glad we were able to get an update on that. Thank you. Is Dr. Cottle here today? I think we were going to do a follow-up on oral health emergency care, but we can certainly put that follow-up to our next meeting if no one is here who can give us follow-up on that.
I don't see him logged in.
Okay. All right. Well, let's move that follow up to April, and maybe if I can remember to touch base and make sure that someone can give us an update on that in April. I'm making notes on a Post-it. And the sad thing is I won't be able to read it, but it's okay. Okay. All right. So our next presentation is on absenteeism. And I think, Christina, are you here with us?
Yes, I'm here.
Wonderful.
And Judy Vanderhart is also here with us today as well.
Okay. Wonderful. So if you guys could just introduce yourselves and just and please feel free. We are turning the meeting over to you for your presentation.
Thank you. So I am Christina Watford, and I am a program consultant with the Persistence to Graduation team at the Kentucky Department of Education. I have been with the department for just a little over a year, but my background is that of a school counselor. And so I have a long history in the school setting, not only as a school counselor, but also as a classroom teacher as well. And then I'm going to also let Judy introduce herself to you as well.
Sorry, I'm talking on mute. Good afternoon. My name is Judy, and I work for the Division of Student Success at the Kentucky Department of Education, also on the Persistence of Graduation team. So we work on a wide array of topics, from human trafficking, suicide prevention, sources of strength, a lot of things related to dropout prevention. And especially, we're heavily focused on tools that support schools to that identify students who need support before it's too late, as far as, before they may leave the system. So attendance is one of those areas. And can you all see my screen?
Yes.
Okay. So I'm going to go ahead and start kind of talking a little bit about chronic absenteeism. And Christina will talk later about some of the kind of key strategies that are being used. I guess the first thing is to just talk about what chronic absenteeism is. It's basically anytime students are missing 10% or more of time in school, that's considered chronically absent. And of course, there's a wide continuum of chronic absenteeism from, just meeting that 10% to very high percentages, like missing 60, 70% of time in school. How this differs from like the federal definition, for example, that's usually based on days. But Kentucky measures students' time in school by the minute. Chronic absenteeism includes not just excused absences, so when students are sick, but it also it includes unexcused absences. It includes when kids leave school early or come to school late. It includes when kids are even forced to be out of school when they're suspended. So it's just, again, counting the percent of time that they are out of school. And then truancy is based just on unexcused absences. So we have the data is actually a bit delayed.
Have fun.
The data is actually delayed, so we have updated data, and I could just tell you generally, as a whole, it's chronic absenteeism has gotten a little bit better, but because it was so bad after the pandemic, it's, typically when we see things like this, if you're at the basement, it's as far as when you look at data is concerned, it doesn't take a whole lot to move up a little bit. So, but that is good news. We are definitely moving in the right direction. It's just small right now. So this is just looking at percent of students who are 20% or percent, basically the districts and the counties. So this is a map of Kentucky, and these are counties. In a lot of places, the district is the county. In other places, there are multiple districts and counties. But this is where there was 20% or more chronically absent. And before the pandemic in 2017-18, the image on the left, you see those concentrations in Eastern Kentucky. But after the pandemic, you see it basically statewide. So overall average in Kentucky, the change was 17% pre-pandemic and 30% post-pandemic. What you see here is chronic absenteeism by grade level. So it also shows the percentage increase. Again, this is pre and post-pandemic. And what do you see, which is very problematic with kindergartners? Kindergarten, first grade, and this is the foundation of their educational experience, right? So it's really challenging up to seniors, right? So you have that 40% of seniors chronically absent. So very problematic data. And when you look at it by student group, so if you go on our school report card, this Kentucky school report card, which you can see lots of different data points for every district and every school, a lot of times the data points are broken down to include a view of students that fall into these groups. And I know this is probably not surprising, again, just like everyone else, pre and post chronic absenteeism got worse. But if you can see, you know, it's like basically the students that need our help the most, right, are their indicators are really distressing, like 50% for homeless students. So that is something that we need to continue to pay attention to and to provide targeted resources and supports. So some of the contributing factors, again, some of this is probably common sense, you know, and you all, based on all of your experience, professionally and personally, have your own perspectives on this. But these are, again, kind of common sense. There are a lot of barriers, including just a lot of them rooted in pure poverty, right? We have a lot of that. It's been really concerning. I know in my district where I am, and I'm in Jefferson County, it's, you know, so many students rely on schools for their food that having another week out after the 2-week break is really, really concerning for a lot of people that work in schools that know their kids are really struggling with the basic needs. But chronic health conditions are also barriers. Transportation is a key one, community violence. And then there is, you know, kind of a lot of the emotional and psychological and factors, some factors related to trauma, but anxiety, which is a huge one. We also know that school climate is a huge driver of whether do kids, is it a place where kids want to be? Is it warm? Is it welcoming? Is it healthy? And and then of course is bullying. Is bullying something that's happening? Is it being addressed? Are there reporting mechanisms? So issues with peers. And then disengagement. So if there's not enriching and engaging teaching and learning situation happening, that's also a contributor. Boredom, you know, I think we can't take away also the impact that social media is having on the attention spans of everyone, not just students, but of us as adults. But I think disengagement is a piece, definitely out of school suspension when kids are excluded for things. Yeah. So, and really having that sense of belonging is key. We say that in dropout prevention world, and it's the case for suicide prevention and everything else. If a student doesn't feel a connection and have at least one adult that they are connected to, that they trust, that they can talk to, that's a really, really big risk factor for all the things that we don't want to see happen to our kids. And then there's the misconceptions around attendance, like, you know, missing this much time doesn't matter that much, or only unexcused absences are problematic. So there's some of that as well. As far as, you know, this is actually also a big frame. This is a framework that is being used, it has been used in our in education for a long time. So we talk about there's an initiative called Positive Interventions and Support, so Positive Behavior Interventions and Supports, PBIS. And then we now kind of call it MTSS, which is Multi-Tiered Systems of Support. So it's basically a framework for how we look at what we should have in place for students who have varying levels of need. And this was actually adopted from the medical field. So It's basically looking at that intense intervention. You're going to have typically 3 to 5% of your population that need tier 3 support, that intense level. And then you're going to have 5 to 10 or 10 to 20% in the early intervention piece that kind of are tier 2 that need some extra support beyond tier 1, which tier 1 is everyone. All kids need the tier 1 supports. If you have a solid tier 1 prevention in place, if you have these universal things in place in schools, you're going to reduce the flow of kids needing that tier 2 and then that tier 3. So when we talk about chronic absenteeism, Christina's going to talk about, so tier 3 is like really needing like intensive case support for students when we're talking about attendance issues. Tier 2 is kind of kids need more support to help remove some barriers. But then tier 1, again, is for everyone. It's all about, do we have that climate, that culture in our school that supports the well-being of everyone, of adults and students alike? Is there a sense of safety, both physical and psychological safety? Is there, are there meaningful connections, meaningful curriculum and things being taught? And is there that, sense of belonging too with families? And also, of course, staff cohesiveness. So, Christina, we're focused today on tier 1 because it is the most important. So Christina's going to talk about the specific strategies with respect to chronic absenteeism for tier 1.
Thank you, Judy. So, as Judy has already mentioned, one of the things that we really try to drive home in our presentation is just the importance of relationship for students and staff and for their parents, as well as extending those relationships out into the community as well. Because really relationship building is the foundation of everything that we do in a school setting. So that's kind of like the most universal thing to think about is how are we really connecting with our students? How are we connecting with their parents? How are we connecting with, their broader family and then also the community? And so that leads us into fostering a sense of belonging in the building and creating a culture in the building where students really want to be there. Are we using positive and nurturing language? Are we greeting them by name whenever they come into the building each day, when they walk into the classroom? Do they feel like that they are seen and that they are recognized? Providing opportunities in the school setting for morning meetings or advisories, which can just be times that are not necessarily academically driven. It's just a time for those relationships to be built so that students do have trusted adults in the building. Judy's already mentioned the PBIS, which are those positive behavior interventions and supports, as well as the MTSS structure, which is kind of our broad overall structure. Helping to provide some restorative practices for students. So if everything is punitive when a student does, something wrong, or, when there's a negative behavior of some kind, if it's always punitive and there's not anything that's teaching them how to restore relationships and how to, for lack of a better term, kind of pay back, then we're really doing them a disservice. And so there is a real emphasis on providing those restorative practices in the school setting as well. Providing some attendance incentives. One strategy that Judy and I really like to talk about when we do trainings, not only on chronic absenteeism, but also on some of the data tools that are available to staff members, is on relationship mapping. And it's just a strategy that is designed to ensure that every student in the building has an adult that they are connected to, that they feel like they can go to. And all of these are designed to create a sense of belonging and a sense of safety for students. Also looking at whether or not we are providing opportunities for all students in our building, not just the most popular students, but for all of our marginalized student groups as well, through enrichment and extracurricular activities. And then again, looking at those opportunities through like advisories or morning meetings where it's not always an academic focus. There's just an emphasis on let's build relationships with students. And then we also can't neglect the well-being of the adults in our building as well. And so, if I, as a staff member, do not feel that I belong, do not feel like my well-being is being looked out for, then there's a real problem in the building, because I can't feed into other people if I don't have things feeding into me. And in a state that's faced with a significant teacher shortage, this is increasingly becoming an area of focus in buildings as well, as it should be. So you can go on to the next slide. So the next one is just looking at making sure that the learning opportunities that students have are meaningful to them as an individual student and also relevant. So helping them to connect their learning to real world experiences through project-based learning, providing cooperative learning environments and also collaborative learning environments, and then giving students who need those hands-on learning activities, opportunities to be able to engage in things that are not just sit and get opportunities are really important as well. Because if they can relate to what's being taught, then their interest level is going to increase, which is going to help to increase their motivation as well. And that helps them to retain information and to comprehend and to be able to use their learning in ways that are meaningful to them as an individual student. And then we also have to make sure that our teaching is culturally relevant. And so that's a huge focus in schools as well, because we want to make sure that what we're teaching to students is information that they can relate to in their own personal lives. And we all bring, our own set of circumstances based on our family of origin and our culture and our community. And so we just want to make sure that learning is something that they can relate to in terms of their cultural relevance. And then providing them with frequent and meaningful feedback. It used to be that, the only feedback we ever wanted to give was on learning. And a lot of times that, came across very negatively. But we now understand that there needs to be an emphasis not only on feedback about learning and what we're, not doing well, but more importantly, what we are doing well on, and then also providing feedback around student behavior so that we can help them to learn. And that ties back into some of those restorative practices, as well as, feedback on their attendance. And so a lot of times students just don't understand how attendance feeds into what they're learning in the classroom, especially coming out of COVID, because for a long time during that COVID period, we had flipped to a fully virtual platform for long periods of time. And so a lot of times the message was kind of came across as the only thing that you have to do is to complete your work and turn it in. And that tells us everything that we need to know about your learning. When in reality, what's taking place in the classroom, which ties to their attendance, is incredibly important. And so helping them, providing feedback to them on, why attendance is so important. And then lastly, looking at setting up a system where we have an authentic assessment of student learning. So not just pencil and paper tests, but, what project-based pieces are out there? How can we measure learning, and how can we assess learning in ways other than just giving me a summative test at the end of a unit, and something on paper spits out whether or not I have learned or I haven't learned. So looking for opportunities to be able to assess learning through a variety of modes is actually a big initiative of the Department of Education moving forward. So there'll probably be lots of changes coming up pretty soon to our assessment system, because we just feel like that will provide more meaningful assessment data and input for students, so that they can really figure out where they are. Also looking at student health initiatives. So a lot of schools partner, I would say probably all schools partner with local community agencies in order to address a lot of the critical barriers that they are up against, so that we can help to turn attendance around for students and encourage them to come to school. So there are a lot of schools who are looking at not only physical health partnerships, but also mental health partnerships. We also have dental partnerships. I'm sure that you all are very familiar with those. But these services really help to provide opportunities for students to come to school and to have some of those needs met that if they didn't come to school may not be able to be met in other ways. You know, maybe just some of the barriers that their families are up against prevent those services from being able to be provided. Transportation is also a huge barrier for students, starting with student safety. So, you know, making sure that they feel safe at the bus stop. We have communities that are using parents and volunteers, or they are hiring staff in order to make sure that students have safe passages to the bus stop and then from getting back home. Looking at building partnerships with public transit systems or other transportation resources that will help students to get to school when they miss the bus, if they have a doctor's appointment, if they have any other reason that prevents them from being able to catch the bus at the beginning of the school day. So, you know, if I miss the bus and I don't have any other way to get to school, then that impacts my attendance. And so really taking a look at what we can do to try and help address those barriers as well. And then food can also be either a barrier for coming to school, or it can be an incentive for coming to school. And so we've seen several articles recently about schools who are adopting open eating policies so that students can eat whenever they need to during the school day, partnering with community agencies to provide snacks for students to be able to come and pick up. A lot of times these are services that are provided through Frisk offices, which are just incredibly vital services provided in schools as well. We also have schools that are providing breakfast for longer periods of time so that if a student does miss the bus, they still have the opportunity to get breakfast whenever they get to school. So that is another way that schools are looking to try and help incentivize coming to school. And then we also have, you know, schools who are providing some basic needs and basic services such as laundry services or clothing closets for, you know, students who are struggling with the ability to be able to clean their clothes at home or you know, having clothes that they feel comfortable wearing in the building as well. And again, a lot of times these are services that come through a Frisk office, and I just cannot stress enough how important the services that that particular office provides in a school really are. And then also looking at communication. So when we talk about communication, we have to talk about the climate and the culture of each building, because that's going to dictate how attendance campaigns are perceived, because one of the challenges that schools face is that we have to teach students and we have to teach parents and we have to teach the community why attendance is so important. Because if we go back to what I said a little while ago about, you know, when we were in COVID, it became a system where turn in your work so that you can get your grade. Everything was online or on the computer. All of their worksheets or all of their assignments and projects they were doing on a computer, and then they were submitting them. And the message that was received on the student end was, well, all I have to do is do my work, and that's, you know, going to get me the grade that I need. But the piece to a lot of that was missing and that we're now having to do some work to undo as a result of COVID is, you know, really stressing the importance of learning in the classroom environment. Why is it that coming to school is important? And it's more than just completing your work. It's actually learning what your teachers are trying to teach you and what we want to teach you inside of the school building. And one of the big challenges is, educating parents and students about that, and convincing them that there's value in the classroom experience and not just completing work. So schools are challenged with a variety of attendance campaign measures that could include, sending letters welcoming them to the school, not only at the beginning of the school year, but then throughout the year, to keep parents and students informed about all of the things that are going on that students really benefit and are enriched by participating in. Sending text messages. We've got several examples of some really positive text message systems that really personalize attendance for students and help parents to know where they are in terms of attendance for the year. Same thing with emails, email systems, providing orientations, not only at the beginning of the year, but then also family nights throughout the school year in order to engage parents and families, as well as having staff members pick up the phone and make positive phone calls so that, parents and students are hearing good things coming out of the classroom. Those are all things that are really important. I think we can go on to the next slide. So we do want to let you know that in order to help and assist schools with that communication piece and encouraging attendance, the Department of Education launched a chronic absenteeism campaign in August, right as students were coming back to school. And that campaign has consisted of billboards, radio ads. We have posters that we have sent out to the school that mirror a lot of the billboards that are up and around in some communities. We've also had streaming ads on TV, and all of this was designed to highlight for students that we miss them when they are not in our building, that they belong there, that we want them to be there. And so it's really an effort to help build that culture statewide and create a state level tier 1 kind of universal prevention piece for all students about why their attendance is important and the fact that we miss them when they are there. We can't educate them if they're not in our buildings, and we really want them to be there. So I think that you all have access to this particular presentation. We have sent it over to be shared with you all. And if you will click on that chronic absenteeism webpage, there are a variety of resources that the state has released for schools to use. There are letters to staff members highlighting why attendance is so important. There are letters to parents highlighting why attendance is so important. There's an entire toolkit in there with a lot of resources and that schools can print and send. They can also customize it with their own logos and send it out. So we tried to take some of the work out for schools and make communicating with families a little bit easier. So there are a ton of resources on there that we encourage you to go and take a look at as well. So, and then, as Judy mentioned, when we move up the ladder and we are looking at those tier 2 and those tier 3 pieces, everything that we've talked about today is designed to target every student. And then as students begin to show that there are attendance issues, then they would tier and they would level up into the tier 2 and to the tier 3. And so a lot of these same strategies would still be used. They just become a little bit more intensive and a little more personalized when we get into the tier 2 and into the tier 3 strategies, because those are the students that seem to be struggling the most. But if you all have any questions, we would be happy to answer them for you now to the best of our ability. We also provided our contact information for you in case you have any questions that come up later on, or if you have any additional requests later on. We wanted you all to be able to know how to get in touch with us. So are there any questions that we can help to answer?
Thank you all for this presentation. That was very, when you were first going through the statistics, I was like, okay, what do we know why? And of course you do know why. So it is disturbing to see that somehow families got the message that coming to school wasn't really that important. That they could, as long as they did their lessons like in COVID, you know, then they're fine. And I think, and I know Dr. Smith can comment on this too, but a huge piece of what we saw happen with a significant number of students is that learning from peers, interacting with peers plays a huge role in their overall well-being. And, you know, I saw a child that you know, just was devastated by online learning, that he just didn't want to do it, and he was depressed and he was sad, and he went back to school, and I realized it was one of those things that none of us could help, but it made a tremendous difference in his overall well-being when he went back to school, to in person. So
Yeah, and
thank
I think that was definitely an unintended consequence, right? I mean, we had to pivot so quickly, and then we stayed in that we stayed in that pivot for probably a much longer period of time than anyone thought that we would, right? And then, you know, the challenge of that year that we did return, we were in school, out of school. We were in school, we were out of school. We were in school, we were out of school. So we were constantly having to shift. And it was really a struggle for students coming back. And, you know, it's funny because while, you know, you say that that one student really did not like the virtual learning, we also saw a lot of students, so it's kind of a mixed bag. We had, you know, a lot of students who really struggled with coming back into the classroom as well. So, you know, schools are really challenged with trying to address both sides of that coin.
I would agree with what Dr. Grigsby said. I feel like, well, first of all, I am delighted about your presentation, and all the information was so helpful. And I'm thankful to know about the website. And, you know, we do have kids that we see in my clinic and beyond that have a lot of trouble with school. And we also work with a chronically medically ill population here. That's one of my areas of specialty, and who have no immune system. And so school is really scary and tricky, and sometimes they can't go back for a little while. But I do think that the pandemic, you know, it was the best solution we had, and yet it feels to me, and from the mental health world, that it's now feels so easy for parents to say, oh, my kid's anxious, they can't go to school. And I'm not minimizing that that's hard to go to school when you're anxious, but usually the only way to get better is to go to school. You know, it's that exposure, and with support, and with, you know, so I'm delighted to hear of all the things you guys that are being done to encourage and support people to be there as much as they can, because I can't agree more that I think so many things happen at school beyond the learning, though that's obviously the critical part, but the social opportunities, and just, you know, separating from your family and having your own world and your people, and all those things are so important, I think, because that's how we've constructed it in our society. And so if you don't have those opportunities, it can be more challenging, not for every single kid, but for many kids if they don't. I mean, homeschooling is definitely a thing, and many people value that, but often they're also participating in other social things and other activities. So I'm preaching to the choir, but I appreciate your presentation. And it was just super helpful to know that all this is going on and exists. And where have I been? I don't know. I just didn't know all these things. So,
Well, thank you for having us. We really appreciate the opportunity to come and talk with you all today.
Yeah, thank you.
Yeah, well, thank you so much again. Any other comments, questions, observations from others on the meeting? I agree with Dr. Smith. I love seeing all the support that you're giving each, you know, all of the students, and then those that need additional help, how you guys are, I know you guys didn't talk a lot about it, but just seeing what you're doing for every student is really very encouraging. So thank you again.
Thank you.
Any other questions, comments? Okay, Moving the next old business agenda item is to look at the April meeting date. I think this week was, I think the thought was that we would move this tax meetings to the first Wednesday of the month. In April, that will be, but we had to go to the second week because of the holiday this month. But I believe that would put April's meeting at
April 2nd.
April 2nd. Um, any concerns about that date or any problems with that date?
I know I had mentioned that I have a conference and I will probably be traveling that day because the conference is in Phoenix and it starts the next day. So I know that I may not be here, but hopefully we'll have other TAC members able to join. And then we were talking about moving it to the 9th, but I think that was spring break and maybe it was only me that it was gonna affect, or maybe that isn't spring break. Don't let me misspeak. I don't know when spring break is, but I know that I will likely not be able to attend on the 2nd. But the other dates obviously are fine. I think they're July 2nd and October 1st, I think.
Yes, correct.
Donna, if you'd like, we can always poll everyone after the meeting as
Okay.
that gets a little closer, and if
Sure.
we're not going to have a quorum on the 2nd, we can try to move it to a different date to
Okay.
try to help work on getting a quorum. Excuse me.
Yes, no, I think that's a good idea. Since there are only two of us here today, we can reach out to the other members to see. And what I will do is, because Wednesday is a typical clinic afternoon for me, I was just glancing. I think my schedule has already been blocked for that first week. I just need to make sure until we know for sure that I don't have an open template on the 9th, but let me just see. Right now, I think I probably do have an open template, but I can have that blocked for another week until we're sure what we're gonna do with the other members of the TAC. So we'll poll the other members, and then as soon as we hear confirmation back, we can go ahead and finalize that meeting date. Does that
And I
sound
hate
good?
to have you change anything on my account. Please don't change on my account if the 2nd works for most people, as long as that you think that you'll have a quorum. I mean, it looks like I could do the 9th, and I just blocked that in case
Okay,
you decide to move it, but just know that I for sure will probably be traveling.
okay. All right, good to know. Thank you. And I do believe, at least for Fayette County, that spring break is that second week. It's an odd year because usually it's that first week, but I
Yeah,
think,
right, the end of March, 1st of April, yeah, so it is a little bit later.
yeah. All right, any other comments or any other conflicts that any other guests of the TAC have for, or strong feelings about when the April meeting will be held? Okay. We do not have anything listed under new business, but does anyone
Donna,
have? Yes.
I'm sorry, I couldn't get off mute quick enough. This is Erin. At a quick glance in our April schedule,
Mm-hmm.
due to all other tax, if you want to keep it on a Wednesday, we would need to bump it to April 30th. But I can look at alternative dates on the calendar if you would like.
Okay.
Or I can ask in the poll if the 30th works, and if not, we can look at other dates.
Okay. Let me look at.
So we don't need to hold the 9th, then, Erin, we would need to hold the 30th.
Yes, please. It looks like on the 9th, there is a TAC already at the same time.
Okay.
Same for the 16th. Oh, my apologies. The 23rd or the 30th would work.
Okay. Okay. If we can just send that poll out as sooner rather than later, just because I need to get those. If there are other dates I need to hold, I need to get those on hold quickly. I think right now, either of those dates would work for me if I get my template blocked. Let me
Yeah, and the 16th or 23rd, I appear to look like they would work for me as well. I'll just hold on to them until,
Was it the 23rd and the 30th, or was it this? I'm sorry.
23rd and the 30th.
Okay, the
23rd and the 30th. Sorry. Not the
No
16th.
worries. And I just sent the email.
Okay, thank you. Because
So not the 16th, the 23rd or the 30th. Okay.
okay, right now that would work. Either of those dates would work if I can just get them. If we can make a decision, then I can get that date blocked without having to reschedule any patients. Okay, any new business? Okay. The next under general discussion is future topic suggestions. I don't know if there are any other topics. We have previously mentioned preventive care visits for adolescents and bullying. Any other topics that we feel like are important to visit?
And real quick, we're gonna keep dentist, the oral health emergency back on hold, correct?
Yes.
Okay.
We're gonna follow up on the first two items as old business at the next
Okay.
meeting. But right now, we don't have a new agenda item for that meeting.
Let's see.
So are there any topics other than the two listed here? And is there, I mean, they're only, unfortunately, Dr. Smith and I seem to be making the decisions today, which is okay, but are there any pressing discussions that need to occur for in the April meeting, or are either of these topics more timely for the April meeting?
Can you remind me what we were thinking about the preventative care visits for adolescents? Specifically?
I'm just trying to remember if we were going to look at information about how we were doing with that, how we were doing with our vaccination rates. And maybe that's a topic that we put out to the MCOs about what programs they have to get the adolescents in for their visits and what kind of services are covered for adolescents.
So just well checks, in other words,
Yes.
broadly. Okay. That's what I thought, but I was wanting to make sure I didn't miss something there. Okay.
For our MCO partners that are on the meeting, would this be a topic that if we discussed it in the April meeting, you guys would have time to put information together?
Yeah, Dr. Grigsby, this is Stuart on with WellCare.
Yes.
Along those lines, y'all may not be aware, all of the MCOs have DMS as a value-based payment initiative right now that's going on for 3 years, and where we're all there are 6 core measures. 2 or 3 of them are immunizations. There are 4 other, and so they've actually withheld money for them. And we already, basically talking about immunizations, of course, they've gone down since COVID. There's a lot of misinformation. And my goodness, we have all been innovative, tried so many different ways to try to, reverse that trend, but it keeps going on. So it is a chronic, continual challenge. But anyway, there's a program going on, value-based payment program related to this that we are all involved with, all the MCOs are involved with, and trying to reverse that trend. Like I said, at least 2 of the 6 core measures, their HEDIS measures, are immunization related. So we are all definitely tracking that and doing a whole lot of stuff. And would appreciate all support we can get Cause it's just, you know, I mean, and I think we've seen like stuff like measles are coming back, you
Mhm.
know, I mean, it's very alarming what's going on. And, all the MCOs have been, you know, trying to do everything we can think of to try to, you know, change it and help kids and help make sure that they get immunized. All of us, for example, at the state fair last year, we
Mhm.
partnered where our association did, and I think it was over maybe 2,300 individuals got immunized at the state fair.
There's so much misinformation,
Mhm.
and it's frightening. And I feel like it really did come to a head with the new COVID vaccines. And we know that, measles is so contagious. I think people, many people in this current generation have never seen measles, have never seen what they can do, have never known anyone who's had the measles. And, if those immunization rates drop below 90%, that's when you see measles outbreaks because, measles is one of those respiratory viruses. And I tell folks all the time, it's one of the most contagious infections that we know. And for every index case for contacts that are unimmunized, there are 20 additional cases for
Oh,
each index case. So you can imagine how that very quickly spreads
yeah.
because it's just so contagious. Um, so that may, I would be interested to know. I know from a healthcare standpoint, from a healthcare enterprise standpoint, I know what our measures are and what measures we've been working on, but it might be interesting for us to know what you guys are being, what kind of measures you guys are being evaluated on. Because,
Yeah, and these are HEDIS,
yeah,
and there's a total of 10 HEDIS measures, and I don't remember them all off the top of my head. But at least a couple of them are immunizations, I think visits, you know, the well child as well. And we've seen that, you know, as well, obviously dropping in tandem. And I know particularly we've seen just some like care management, other staff talking to providers, families, members that particularly younger female parents have really have a great hesitancy with the immunizations for their kids.
well, and it's, there's a lot of information out in the media,
Yeah,
reputable and non-reputable, where they're calling for the first time in my significantly long career, right? I've been in pediatrics for over 30 years. And this is the first time that I can remember getting so much resistance to certain vaccines. And certainly it's almost bled over to other vaccines.
yeah,
Because there's all this information out there about, you know, giving too many vaccines at once is a problem. And yeah, so it is a challenge for all of us right now. I don't know if you all have heard the stories about polio. There
yeah,
are polio cases in Gaza because they can't get the vaccine. And so we know those infections are still out there. I mean, very few infections that we saw 50 years ago have been completely eradicated. So it is very concerning. I agree.
and it will remain a key topic. I mean, it will. You know, every meeting we could talk about it.
Yeah. Honestly, I feel like the preventive care visits for adolescents a lot of times get pushed by the required vaccines. So a lot of times we may lose contact with an adolescent between 11 and 16 because there really aren't vaccines that are required. But when the school says, "Hey, you know what? You've got some vaccines that you need. You got to get in for your checkup." Sometimes that helps drive that.
And that's been relaxed too in laws, more, more exemptions.
So that
Right.
adds another concern that you potentially won't see kids from 11 till who knows when they're adults, they might show back up at the doctor or whatever. If
Well, and a lot of young adults don't go to the doctor.
they don't go to the doctor.
Because they're not sick, right? Or they don't have a chronic illness, or they don't feel a need. And they go through a period of time where they're not on an insurance. There are lots of folks that are on their parents' insurance, and then they have that gap between when they're on their parents' insurance and when they can get their own healthcare coverage.
Mhm.
So there are lots of factors that are barriers to patients getting care. So I guess my question then would be, I assume there are incentive programs for getting adolescents in for checkups that are independent from vaccines. Is that correct?
Yeah, I think, I mean, I'd say probably every MCO does.
Mhm. So perhaps that's maybe what we need to touch on.
I don't want to speak for the other MCOs, but I think.
Well, no, but I don't know. I feel like it's one of those situations where until we've asked you guys for the information, we don't know as members of the
Right.
TAC what all of the wonderful programs that you guys are doing to get patients in the door. And so until we kind of request that information, we may not know all of the hard work you guys are doing in the background to try to get patients in. Yes. No, I see that. That for those of you, Leslie from Humana just commented that there are incentives in place. So maybe if we could ask for, let me ask for two things, and you all can tell me if this is not okay. One is, can we have a session on preventive care for adolescents? And what is covered and what is incentivized by the MCOs? But then what are our statistics for those patients, of how many of those patients are being seen, how many of those kids are getting the required vaccinations or the needed vaccinations for our April meeting? Is that something you guys think is reasonable?
Yeah, I think, we have the HEDIS measures and that captures, kind of like the performance, what percent are. So
Mhm.
I'm just kind of thinking out loud. I'm thinking we could use the HEDIS measures as the uniform thing
Mhm.
that's my humble opinion,
Okay.
for those data.
Because one of those HEDIS measures is specifically for adolescents.
Yeah, I believe, and there's 90 something measures. I'm pretty sure.
Okay. Any other
So,
comments or questions?
Donna, I just want to make sure I have captured it correctly. So when I send the request to the MCOs, that we would like for them to do a presentation on their HEDIS measures around preventative care and vaccinations, correct?
For adolescents.
For adolescents.
Yeah.
Okay.
Because they've already given us that information I feel like for the younger children.
So the incentives and the outcomes sort of are what we're asking for.
Yeah. Other comments? Okay. Thank you. Since we don't have a quorum, we can't really make recommendations to the MAC. I know that Dr. Smith and I both have clinic on Thursdays, and I believe the MAC meetings are on Thursdays. Is that correct,
Yes, ma'am.
Erin? Okay.
Yes, ma'am.
So I don't know that we're going to have a representative at the next MAC meeting. And then we are still discussing the date of our next meeting. And do we have any other comments, questions? Okay, if not, we will give you all the gift of time today, and we appreciate you being here and joining us, and we look forward to your presentations at the April meeting. And if did any of the other TAC members join?
No, ma'am.
Okay, so if Dr. Smith, if you and Aaron will stay, we will work on next time's agenda.
Perfect.
But thank you guys very much.
Thanks.
Have a great day. Stay safe and warm.
Yeah, everybody stay warm.
Thank you.
We'll give it just a moment. Oh, and let me. Oh, gotta remember to stop recording.